what happens after CAMHS, and I think it's really important to stress that the majority of people don't have to transfer from CAMHS to adult services. So there's a minority of people who, for good reasons, will transfer to the adult service, and this is something that should be managed proactively. So for those young people transferring from CAMHS to adult service, what should happen is that they should have a transition CPA meeting. That's a care plan approach meeting with their clinicians in CAMHS and also clinicians in the adult service to make sure that the transition is as seamless and easy to navigate as possible. So there's the forward planning and the transition protocol to follow. It's probably around 20% of people who transition from CAMHS to adult services. That means the other 80% who've been receiving care from CAMHS go elsewhere. And I actually think that this is a good opportunity for everyone to stop and think about where is the right place for me to get my treatment and support, for my loved one to get their treatment and support. So back to the point about those young people who don't go to adult services, that doesn't mean that they don't have needs. It doesn't mean that that they can't be helped. It just means that there may be different ways of them accessing help. And for those who do transition, they should have a transition care plan, and that would be something that's co-constructed by the young person, maybe involving family as well, ideally, and the CAMHS clinician, and also someone from the adult service. And that should happen about 6 months before the 18th birthday. For people who transition out of CAMHS, those young people will also have a care plan. It will be a discharge care plan, but that should also contain information of who to contact, what to do with this, what to do with that, and make sure that no one is left without a plan of what to do next. And if things change, then the system needs to know that and understand that, so that the system can respond appropriately and manage things safely. If you find yourself in the position, as all young people will, of eventually leaving CAMHS, there will be changes, and one of the big changes, and perhaps the most difficult for some young people, will be the loss of a relationship with a significant person in CAMHS, their clinician, and that probably shouldn't be underplayed. And the more preparation that you can do with your clinician around what you're going to be doing next, how to achieve a good ending and a safe ending, that would be discussing what options are available in the community for you, and your CAMHS clinician should be able to help you identify those and also help you to be referred to those. The GP can do this as well, and of course you can self-refer to many services. So I encourage people, if they haven't got a next steps and they're approaching discharge from CAMHS, then speak to your clinician, speak to your team, and ask them how they can help you to identify what's going to be happening next, who will you be going to, and if necessary, make that referral to the next service. Sometimes there can be some flexibility around the point of transition, so it doesn't happen on your 18th birthday literally. For instance, if you're on an inpatient ward, you may have a few more days on the ward before you're transferred to the adult service. And I think it's important for services to make sure that they put the young person at the centre of the transition, so do what's best for them. And for that reason, some young people might be taken on a little bit earlier by the adult service, or some young people may stay under CAMHS a little bit longer until there is a safe and logical time to make that transfer. But that shouldn't be for extended periods of time. That should be time limited and managed by the services.